Thank you very much for that introduction, and thank you to the Macular Degeneration Association for inviting me to speak to you today on this topic of low vision rehabilitation. And if you don't mind, I'm going to come down here. I kind of like to be a little bit closer to you all, and hopefully I'll be able to get the slides to change. So we've had some really interesting talks today about the eye disease called macular degeneration. And it's very fascinating because I know, we talked about the diagnosis, the treatment, and the real hope for future treatments for this disease. But in spite of all of our best efforts, it's very true that patients often have to deal with the reality of vision loss from macular degeneration. And that vision loss causes difficulty in their daily lives, and it causes a much less quality of life, something that Dr. Kim mentioned when he talked about the implantable telescope. So I want to spend some time today talking with you. This is where low vision rehabilitation can help. Low vision rehabilitation addresses the vision loss caused by the disease. So today I'm going to answer these very common questions. The first of which is, what is a low vision specialist? And what really to expect from a low vision exam? These are important questions that I think you need to have a better understanding of. And then I'm going to explain the role that occupational therapists play in vision rehabilitation. And I also want to talk about the devices that are used in low vision rehab. And I better put my glasses on because I'm standing too far away from the slides. So they weren't for me. And then I want to get to something at the very end, which is a very special treat. I've asked one of my patients to join us today, and she's going to share with us in her own words her experience going through vision loss. And it really is a journey through the vision rehabilitation process. So I hope that's very helpful to hear it from the patient's perspective. So what is a low vision specialist? We'll start there. Well, usually a low vision specialist is an optometrist, but sometimes there are low vision ophthalmologists. And usually an optometrist can choose to do additional training after optometry school. And this would be a one-year program, either called a fellowship or a residency in vision rehabilitation. Now, the low vision specialist is part of your eye care team. Usually patients with macular degeneration, they have multiple eye physicians. They might have their general optometrist or ophthalmologist who might have diagnosed their condition, and then they may have been referred to a retina specialist who really is also managing and treating the disease itself, the eye, so to speak. But I want to say that many patients have the vision loss and need additional services from low vision care. So hopefully you'll be referred or you'll go out and see a low vision specialist to perform a low vision examination, because the focus of the low vision examination is on treating the vision loss that's caused by the disease. And that's a very different type of examination, and it plays a very different role in the overall care of our patients with AMD. So I typically have patients coming in complaining of the kind of things that Dr. Kim mentioned. Trouble reading, trouble driving, maybe concern over whether they're going to be able to renew their driver's license. They may be facing this for the first time. Maybe difficulty watching television, or a common one I hear now is the computer. The computer is such a more common way for people to stay connected and to stay informed. So computer is often listed as one of their difficulties caused by the vision loss. Being able to see faces, being able to recognize people across the room, being able to see their friends, see their family. So also being able to write their own checks or manage their own finances is a very significant concern. Things out in the community like shopping, being able to read price tags, labels, menus. The vision loss can affect their hobbies, having more difficulty doing crafts, playing cards, golfing, all kinds of things come out, and these are things I want to know about as part of my low vision examination, because I'm going to target those things as treatment, as ways that I'm going to treat the vision loss. And I also have patients with more severe loss that have difficulty with everyday activities, things that we kind of take for granted, like even being able to set the thermostat in our home, being able to set the stove and oven, to use their appliances. to plug things into the wall, to see the food on their plate. These are things that are often affected by vision loss when it becomes more severe. And another thing Dr. Kim mentioned was the walking, the falls, trouble with mobility. Patients with vision loss have a significant higher risk of falls. So we want to address that. We know falls play a very serious role in this population, so we need to take them very seriously and consider that impairment as well. So the goal of vision rehabilitation is to help patients adjust to the vision loss. I'm no longer focused on treating the disease. That's the job of the retina specialists and your other eye doctors. But my job is to look at how this vision loss has affected your daily life. And we help patients adjust in a physical way, learning how to do things differently, or training, learning how to use low vision devices or prescribing low vision tools. But there is also an emotional adjustment that's really important. And that emotional adjustment often needs to happen before patients can fully participate in a vision rehabilitation program. Because maybe the patient hasn't quite accepted this condition. And if they haven't accepted it and they are still in some stage of grief or denial, then they might not be able to really utilize the tools that I'm going to show them and I'm going to give them. So part of my job as a low vision specialist, and as all of us as eye care providers, need to be very in tune to the emotional adjustment patients have to vision loss, because we know that low vision patients have a 20 times greater risk of depression than their age-matched norms. So this is a significant problem, and we have to be very sensitive to it. Another goal of vision rehabilitation is to let patients know what in the community is there to help them. So I want to inform them of community resources. Division of Blind Services had a booth out in the hall today, and I hope you had time to go by and talk with them. DBS is there for patients who are visually impaired, not just to, the name implies you have to be blind to participate in their services, but that's not true. Anyone with a vision impairment can benefit from the services that they offer. And also there are classes at the Lighthouse, which is a community resource for individuals going through vision loss. So independent living classes and computer classes are just a couple of examples of classes that are available in the community lighthouses. Also, the Veterans Administration has low vision services. So I need to let patients know who may qualify for these other services that they are there to take advantage of. And then support groups. Support groups are often in the patient's communities, so I'll let them know that they can attend support groups and really make a lot of progress emotionally and have that support of others who are going through this condition. And then I let them know about transportation services, because often we are having to deal with the reality of maybe changing, maybe having to give up driving, and making some other arrangements for transportation. So, who pays for low vision care? Well, the good news is that this is something that Medicare does cover. They cover the low vision exam, and they cover occupational therapy training. I have an occupational therapist in my office, and oftentimes the training is very important, and I'm glad when I can offer it, and especially that it's covered. Who pays for low vision devices? Well, this is what Medicare doesn't cover. So patients have to pay for devices, or sometimes we can turn to the VA. Sometimes the VA will assist, and even Division of Blind Services on occasion can help patients get the equipment they need. Or also even turn to the Lions Club on occasion. My job is to help get the devices and the equipment and the training to patients that they really need to make the necessary adjustments to their vision loss. So what can I expect in a low vision exam? Well, first of all, I'm going to do a very thorough case history. That's where I ask you in detail about all those things you're having difficulty with. I want to know specifically what kind of activities your vision is affecting. And then I want to measure your functional vision. And I use eye charts that are special. They're designed for patients who have vision loss. So a different kind of vision testing than what you might have had in your retina specialist's office. I also will look at contrast sensitivity, and that's the fadedness or the dimness of the vision, and that's affected by macular degeneration to a significant extent. That deals more with the quality of your vision, not just the size of print that you can read. And also visual fields. We have patients that not only often have macular degeneration, but they might have other conditions. They may have had a stroke, they may have glaucoma, they may have field loss in the periphery that I need to know about. They may also have central field loss or damage to the central vision from the degeneration. And several speakers today have mentioned that scotoma, that central blind spot or central dim spot. So I may map those visual fields, and then I can help patients be aware of it and adjust to it. And then I want to check the eyeglasses. We call this the refraction. And most people are very hopeful that they can just get a new pair of eyeglasses. And that indeed is also my hope. That's the first thing I will do, and I'll tell you a little bit more about that in a moment, but I do use some special techniques to check for prescription changes. And I need to determine the level of magnification that the person needs in order to accomplish their goals. That's part of the low vision exam. I know you've probably opened catalogs and seen magnifiers from 2x to 14x. Well, which one is right for you? Well, that's the job of a low vision specialist, and in a low vision examination, that's part of what we do. We determine that level of magnification that's right for you and for the task that we're prescribing for. And then I'll try different low vision devices to get an assessment of how a patient is going to function and what kind of device might be most effective for their needs. And then finally, I'm going to sit down with the patient and assess all of these things we've done so far in my exam, and we're going to develop a rehabilitation plan that's right for you. I need to make that plan something that you're willing to participate in. So that's very important. We come together and we come up with a plan that's going to meet your needs. And from that rehabilitation plan, I'm going to recommend the right training, the right tools, the right devices. So that's part of the follow-up here. You know, low vision rehabilitation is really a process. It's not just one exam. So I think that point needs to be made. Refraction. Well, a very careful refraction is necessary because many patients have not had a good refraction in years. You know, changes in patients' prescription are often missed in patients with macular degeneration. I am astounded at how many times I can find a significant change in prescription, and it's really because I take the